Hey y'all, Ben Halbach here at Catto Catto. It is 5 o'clock somewhere. It's 5:16 on Thursday, the 26th. And my colleague and partner in arms, Cyndi Mergele, and I thought we'd have a virtual happy hour together. Cyndi, what do you have over there? She is my best and favorite HR consultant at RSM.
I have a glass of sparkling Italian soda.
That is brilliant. I am working on a little Diet Coke here, so cheers.
Cheers to you, Ben.
Chin chin. So what we thought we'd do today, y'all, is just have a little co-interview here about what's going on in the HR world, and then what's going on in the employee benefit world. And so that's what we're going to do today. So first, sorry, I had a phone call coming in. Life still happens when you're in the middle of happy hour. So Cyndi, there is a lot of information that HR professionals are digesting right now. What do you think of the act that was just released, signed into law as of last week in regards to paid sick leave and expanded FMLA? Give me some of your wisdom about how folks should interpret that.
So, Ben, a lot to take in, but just at a really high level, on April 1st, employers that have fewer than 500 employees will be obligated to provide paid sick leave and expanded paid family medical leave to employees. There is a provision that says if you have fewer than 50, you can be exempted, but there's some provisions around what gets you an exemption. But let's talk about the people that have to comply. So for the paid sick leave, it provides a requirement of 80 hours, 2 weeks of paid sick leave for specific reasons. For an employee, issues around quarantine and isolation is ordered by local, state, and federal agencies. And then some other provisions around people that may be, an employee that may be suffering from COVID-like symptoms. And I'm not giving the full technical explanation, but I'll tell people where they can find it.
Well, it's happy hour. We have to be.
We got other things to do.
Yeah.
So also provides for employees to get paid sick leave if they've got to care for somebody with similar circumstances, quarantine, isolation, demonstrating symptoms and seeking medical treatment. And again, there's a few other provisions. And then last but not least, if there's an employee who has to stay home to take care of kids, because as we know, schools are closed, daycares are closed, babysitters may not be available. Different payment requirements based on whether it's the employee and their own personal health or COVID-related health issues. That's going to pay at full pay up to a capped limit. If it's to care for someone else or the child care, it's going to pay at a lower rate. 2/3 pay also at a cap, but a lower cap. So, and then it expands family medical leave, and all it does is provide for paid leave for parents that have to stay home again with kids.
How does what you just said relate to anything that is already in existence from a PTO perspective?
So one thing that this FFCRA says is that if you've got an existing leave program, you can't cut back. You gotta leave that leave in place. And it kind of falls at the back of the line. Employees have to be given these new leaves first, and they can't be required to exhaust the other existing leaves. They can, though, use existing leave to supplement pay if they're getting paid at 2/3. So long story short, these new leaves are first in line. The others take a place at the end of the line, and employees can't be required to take these existing paid leaves first.
Okay, so let's talk about something you and I were also talking about that really spurred this whole idea of one person who had questions outside of our domain specific expertise calling another professional. So help us translate expanded FMLA.
So, FMLA rules don't change. People still are entitled to leave under FMLA. The big change is, one, you get to take time off for childcare. And that part gets paid. The other big change is for this expanded care, it's not about 50 or more employees. It's now about 500 or less. And interestingly, the challenge for the clients I've been talking to isn't how do I figure out the 50 or less, believe it or not. It's really, how am I getting to 500? And where this applies is if there's an entity or an organization that has multiple entities, and trying to figure out how you decide, do I combine these? What's the law say? And it's kind of complicated. And so what it deals with the integrated employer requirement. And what we're recommending is people talk to their legal counsel to get help in navigating that, because it's not black and white, it's not easy, but it's something that companies are going to have to examine.
On that note, who is my employee for accounting purposes?
Gee, is that like a Jeopardy question?
Yeah, it is. It's like big money, no whammies.
This act says that in counting employees for sick leave, and this is where it really gets kind of confusing because there's two different rules about the count. One has to do with the sick leave, and that's being attributed to Fair Labor Standards Act rules.
Okay.
It talks about joint employers. And what's most important there is you have to count your temps, even if they're not on your payroll, you have to count them. And so you may think, I am under 50.
Yeah.
And again, a little asterisk there. There's some things about being exempted. So, or let's say 450. I'm at 450. I'm going to have to comply. And I want to, because I want to be able to offer these, and I want to be able to get, a tax credit for it. But you find out, gosh, we've got 65 temps, and that's going to kick you over the $500 or the 500 employee limit. And your organization may not be eligible for that credit on the sick leave.
Wow. So, you and I are going to remember this like it was yesterday when the ACA was passed. We weren't as socially or virtually savvy as we have had to become right now, but we were talking a lot about how to translate the implications of the Affordable Care Act on the employer community. So it does not sound like, from what you're saying, that FFCRA follows the ACA definition of who is my employee.
No, it doesn't. And that's another good one. Under ACA, you count full-time equivalents. How many, if we've got part-time employees, how many employees does it take to get to 30 hours? If
Right.
It's 2 15-hour employees, that equals 1. Under FFCRA, it is one body, one employee equals a count of 1 without regards to hours. And that's primarily because benefits have been extended to part-time employees as well. So full-time, part-time, every person that's employed on April 1st is counted.
Wow. Okay,
So
we've
go
talked
ahead.
about paid sick leave. We've talked about the expanded FMLA. What else from your view is out in the marketplace? Because we continue to go to you to help us distill the noise. What is relevant for folks to know?
Well, and I'm just gonna do a few things because I have some questions that I want to ask you. People need to the degree they can ride out this really tough time to see if there's benefits that can come from FFCRA and this legislation that's worked its way through the Senate that's going to go to the House, because there may be opportunities to continue to employ and pay people. Look at the state employment commissions. There's some programs that are there that people can take advantage of that, again, may help people retain employees, because there's industries that if they lose employees, other industries are ramping up. And so, retention is still may be a challenge. And when we come out of this, we want to be able to ramp up quick and have those employees available to us. So is it okay if I ask you some questions?
Sure.
So what's going on with group benefits, but in particular group healthcare? I've got a lot of clients saying, what can I do with medical? I don't, and I don't know if I lay people off, or their hours are reduced. What's happening out there that employers should be aware of?
So we're paying attention to that with laser focus right now. Here's what I would say the response at this point in time has been from the carrier community. They're really doing two things in general, as I see it. They're waving and they're relaxing. And it may seem a little bit counterintuitive. And here's why I say they're waving and relaxing. Couple of fun facts here. They're waiving diagnostic tests for all plans, HSAs and PPOs. They're waiving prior authorization, so you get a fast track if you need the test. They're waiving telemedicine copays for HSA and PPO plans. Some carriers are doing that up to 90 days. Some carriers are even doing that for non-COVID-19 related telemedicine. So you want to ask your carrier how they are responding to that. They're waiving limitations on like early prescription refills and things of that nature. So a lot of waiving previously standard, tried and true insurance nerd stuff. The other thing that they're doing is they're relaxing a lot of different limitations because they need to and they have to, and it's the right human thing to do. Relaxing open enrollment periods so you can continue to enroll your employees. Some carriers are doing this up to 30 days beyond their effective date just because the whole world just changed. And administratively, it's really hard to pull off. So they're relaxing some open enrollment administrative type things. They're relaxing some participation requirements. So if an employer has to furlough or lay off a certain number of their employees, we've had a lot of questions about, is this going to jack with my premiums in the middle of the year because I got to lay off 25% of my workforce, or in some, depending on the industry. To your point, some folks are ramping up right now. Other folks are decreasing headcount. So in the middle of the year, in the middle of the plan year, that's not going to impact the premium due to the carrier whatsoever. They're also relaxing eligibility requirements. For nerds like us, we always take a look at those actively at work provisions and how it relates to both group healthcare and in particular disability carriers. There's a pretty wide degree of interpretation from the disability carriers, so that's very carrier specific. My recommendation there is if you have a question about how a COVID-19 is covered by your disability carrier, ask your broker or your carrier for clarification on that, because from what I'm seeing, just as of today, there's a wide range of responsiveness there. But medical carriers are relaxing. Not everybody has to be full-time, of course. So if you get laid off or you're furloughed, you're not going to be full-time, so you can still be covered under the plan. They're also relaxing some of the requirements on when you can pay premiums. I've seen carriers do this on a 30-day grace period. I've seen carriers do this up to 60 days. You've got to ask your carrier about that, though. So in general, they're doing those two things. They're waiving and then they're relaxing is the typical response that I see right now.
Anything that self-insured, self-funded plans should be thinking about?
Yeah, so here's the interesting thing. Most of the time, regulation impacts the self-funded marketplace first, and then the fully insured marketplace gets guidance from the self-funded marketplace. Right now, it's everything is upside down. So a lot of the regulation that's coming out affects these carriers' fully insured book of business first. Self-funded employers have to opt out of these regulations because they have the liberty to do so. I think in reality, most self-funded plans won't. Most carriers who have both fully insured and self-funded blocks of business are telling their self-funded clients that if you do nothing, the federal regulation is going to govern here, and you're going to do what the fully insured marketplace is doing. If you choose to opt out, then you need to do so in the next couple of days. Today's the 26th. You need to do so by April 1st. So if you want to opt out, you need to in the next couple of days.
So what else? What other, interesting fun facts do we need to know in this very unique time in terms of benefits?
Yeah, so we were talking about this. This is what nerds do when stuff like this comes out. This is an economic report. It's riveting. It's great during happy hour. So the most common question we get is, my insurance premium going to be jacked because of all this? It is still too early to tell, and here's why. I've seen estimates that say a COVID-19 case will be 10 grand. I've seen estimates that say 40 grand. It really depends, and it depends on a couple of things in specific. It depends on how many comorbidities are present, meaning two nasty things going on at the same time that both encourage each other to increase claims on a singular claimant. That's what a comorbidity essentially is. So if you are already elderly and you already have an immune system issue and already have something going else, then the treatment of COVID-19, should God forbid you contract it, is going to be more expensive than, say, you or I, who are relatively healthy, and we go in and the DRGs, diagnosis related groups, would be getting the guidance on like how a hospital would treat the flu and pneumonia. So that's a very different claims expense than an elderly person who is already sick. So it really just depends. And the carriers are also betting that there's going to be a decrease in the amount of elective surgeries. There's going to be guidance about what elective actually is. So there's going to be decreased expense from a carrier standpoint on elective surgeries, but increased expense with relationship to COVID-19. We're going to be watching that really closely, but it really is still too early to tell. The other things that I would just share with you, our channel partners, United Healthcare, have created a special enrollment period. So for anybody enrolled on a UHC plan, there's a special enrollment period. If you decline coverage, you can hop on now. Somebody who enrolled in self-only or employee-only coverage could add a dependent. You can't change the plan that you're on. So you couldn't go in if you were on an HSA and go to a PPO. But that's something we like to see. In addition, Aetna just came out yesterday and said the inpatient cost of treating COVID-19, the hospital cost of treating COVID-19, is now going to be at no expense to the member. That's a big move.
Wow.
That's a big move. They're the first, Aetna was acquired by CVS, so for about 69 or 70 billion dollars. So I should say CVS just came out with that announcement yesterday. So that's a big deal. I don't know whether other insurance carriers are going to follow suit on that. We will watch that extremely closely. We got to talk about the CARES Act. Okay, so Congress pulled out a $2.3 trillion bazooka to aim it to stop the bleeding, so to speak, in the economy. How's that going to impact healthcare? There's $100 billion set aside for hospitals within that bazooka. Hospitals who are treating higher amounts of Medicare patients, who will likely be the ones most affected by coronavirus, will get increased payment via that $100 billion, call it a rifle. That's a strange bazooka and a rifle, but whatever analogy works, right? They got a $100 billion rifle, and some of that is going to go towards Medicare getting 20% more for COVID-19 related treatment. So that's just in. I'm checking out some other notes. Let me see if there's anything else that I need to say. On the CARES Act, it's not law yet. It's passed the Senate. It's in the House. It's going to be voted on this Friday. I don't anticipate any bumps, but you just don't know. We'll see what we see on Friday. Other than that, I think my encouragement to the marketplace is probably similar to yours. Rely on good advice. Ask for help if you need it. The same question over and over again. Frankly, we're all asking a lot of those until we really digest this information.
Well, I will say that your Catto and Catto's website provides some great information. Can you remind me what your website address is?
I know the answer to that, www.catto.com. And I've been to y'all's too. I really, really like it. It's got a variety of advice that we insurance nerds wouldn't give, like tax advice. And what else do you guys have on there?
We've got tax advice. We've got technology advice. There's been some cyber issues with COVID. So we've got that on our site. We also do a weekly COVID webinar every Wednesday.
Okay.
We archive those so people can see them on demand, www.rsmus.com. And right on our landing page, you'll see COVID resources. So clients and any of our mutual friends that watch this can access those resources.
Okay, cool. Well, Cyndi, as usual, it's been great to have happy hour with you. It's like that joke, an HR consultant and a benefits nerd walk into a bar, and this is the result. So cheers. And
cheers to you.
Seeing you virtually again in the near future.
That sounds great. Thanks, Ben.
Thanks, Cyndi. Bye-bye.
Bye-bye.